Hi, I'm Mike Van Gilder. I'm a doctor of physical therapy, and I'm the owner of G3 Physical Therapy here in Encinitas. I think the thing that really sort of separates us, kind of makes us unique with respect to our treatment is that we treat the body as a whole. So when thinking about an exercise program to help counteract the effects of the secondary scoliosis, what we do is kind of in general, if you want to think about improving the person's posture. So I'm going to exaggerate this just for the demonstration, but if this is kind of where the person is stuck with their scoliosis, so again, that concave side is the right side, and all those soft tissue structures are shortened. Think about here's how we end up just from a postural standpoint. So the hips are going to be kind of tight in the front. The thoracic spine and the muscles around that are going to be tight in the front and on the side. And so you end up with a posture in a seated position that's sort of stooped over and sort of bent and twisted to the right. So really, ultimately, our goal as best as we can is to take the patient from this posture to really open them up through their hips. So to get the front of their hips to be able to lengthen, to get their back muscles to be able to lengthen and to actually be side bent and rotated to the left. So it's really a total body approach. And I can show you a couple of real simple exercises that you can do in the doorway that help to sort of undo some of that tightness caused by the scoliosis. So we treat the body as a whole. So if somebody comes in with a back problem, we don't just look at their back. We look at their whole body. We look at their ankles, their hips, their mid-back or thoracic spine, all the way up to their shoulders. That really is what we consider the core. And in our opinion, most injuries involve the total body or the core. And so we work on the core for most patients that come in here, whether they come in with a shoulder injury, a hip injury, a knee injury, or even a foot injury, and certainly with back injuries. So scoliosis is kind of generally thought of as a kind of a twisting of the spine. Typically the twisting is both rotational as well as what we'd call side bend or lateral flexed. So you typically are going to have either a C curve or an S curve, where the C curve is just one area of the spine that is kind of bent. An S curve would be where there are two curves in the shape of an S. When we treat scoliosis patients, which we do quite frequently, what we're doing, rather than really addressing the bony dysfunction, the twists and the turns, that type of thing, we get into more of the soft tissue ramifications of that kind of twisted spine. So if you think of a curve, let's just take a C curve just for simplicity's sake. You've got a convex and a concave side. So if that C is going kind of normal, so left to right, the right side of that C curve is the concave side, and all of the soft tissue structures on that side are going to be shortened, and they're going to stay shortened. Now that's important. It's important to realize that muscles and soft tissues work very much like rubber bands work, where in order to get a muscle to fire and to be useful to you, you first need to lengthen the muscle, much like a rubber band. If I'm going to try to get a rubber band from here to across the room, I'm going to take that rubber band, and the first thing I'm going to do is stretch it out opposite the direction of where I want it to land. And what I do by stretching it out, I store energy, so that now to get this rubber band from here to across the room, all I have to do is let go of the rubber band and it goes flying. Now that speaks to the importance of the ability of muscles, tendons, soft tissue structures, even joints, to lengthen, or what we call load, so that they can then explode or shorten. Now, the problem comes in where that rubber band, or in our case, the muscle tendon complex, the soft tissue complexes, when they get so stiff that they don't load very well, they don't lengthen. So you can take any rubber band, and if you can really load it or stretch it, you can make it fly, regardless of how strong it is. Likewise, if you have a rubber band that's super thick, or what we would say is strong, but it's very inflexible or can't load, if I try to take that really thick, strong rubber band, but I can't pull it back and load it, then I let it go. I can't store energy, so that when I let it go, it just kind of flops down. So no matter how strong that tissue is, if we can't load it, we can't make it perform for us, or what we would call have functional strength. Now that plays a big factor in scoliosis, and what I thought I'd do is show you kind of the soft tissue structures of the back. So here is the back. Obviously skin's removed and all that. Here's the back of the spine, and then these are the most superficial muscles of the back. Now if we peel away the superficial layer of muscles, we get over here, and now we've got muscles that are what we'd call paraspinal muscles, and other more interior muscles or deeper muscles. And then we can even go a step further and get all of these muscles as well, which are the real deep muscles of the spine. Now if you think about the structures, again, in a C curve, so that the side of the concave side of the C curve, all of these soft tissue structures, all these muscles are shortened, and they stay shortened pretty much all the time because of that bony restriction, that C curve. Now what happens then with those muscles not being able to move, not being able to load and explode like the rubber band, they get tighter and tighter. Those muscles become less and less flexible, or less and less able to load and then explode. So what happens over time with those shortened muscles, they get tighter and tighter, and they can actually start pulling the two ends of the C together and actually cause the initial scoliosis, the initial twisted and side bent or laterally flexed spine, to get even more twisted, more laterally flexed, because now those soft tissue structures are literally pulling the two sides of the two ends of the C together. So that is what we would consider a secondary scoliosis, and that is very treatable simply by loading those muscles and doing exercises that work on lengthening those muscles that are on the concave side of that C curve, in the case of a C curve scoliosis. Scoliosis affects other parts of the body by the bony structures being what they are, again, that C curve, and being not able to move very well. Those structures then become tighter, and we just talked about the structures in the back, but we can even talk about the structures in the hip, the structures in the shoulder. Very often a side of the scoliosis, typically on the concave side, it's not uncommon to have to create a leg length discrepancy because the pelvis is affected. Again, those soft tissue structures on that concave side being shortened, that can create a leg length discrepancy, which can then cause low back problems. It can cause hip problems. It can even cause knee and foot ankle problems.